Hi, Dr. Jayaraman. Did I say that right?
You did.
Thank you for spending the time to come to spend time with me to talk about the SR&ED program today. You're a client of Bond.
That's correct. I've been a client of Bond's now for 2 years.
Right. And what's your area of medical specialty? You're a surgeon, right?
Yeah, I'm a surgeon. I specialize in hepatopancreatobiliary surgery, which means surgery of the liver, pancreas, and biliary tract, mostly for cancer. Mm-hmm. I'm also an associate professor at the University of Toronto. Mm-hmm. And I've been working as a clinical surgeon out of St. Joseph's Hospital for almost 13 years.
But you've only been claiming SR&ED for 3 years. What happened to the other 10 years?
So it's a bit of a sore story for me and my wife. My wife is also a physician, and she's been working with Bond for the last couple of years as well. She's a pediatric cardiologist. Mm-hmm. And our previous accountant told us that we were ineligible for SR&ED claims because we were doctors.
Right.
We'd heard otherwise from friends and business associates or research collaborators involved in some of the research ideas that we've been engaging in. And we changed accountants, and our accountant actually directed us to you.
Glad that you came over to work with us, but that's got to be a big regret for you. You lost 10 years worth of benefits there.
For the last couple of years, we've had great success working with Bond, and every time we have those successes, I think a little bit sadly with a tear about the missed opportunities in the years before.
Well, we're glad you're working with us now. So what has your experience been with the SR&ED program itself?
It's been very easy in that I feel like Bond has done all the heavy lifting for us. From our perspective as clinicians and researchers, our focus is going to be on our patients, and it's going to be on our research.
Of course.
And we don't want to worry about dealing with the government. We don't want to worry about paperwork and filings that we don't understand or that we may do incorrectly and get into trouble.
Right.
And so Bond, as I said, has done all of that heavy lifting for us. And what that's allowed us to do is we just focus on the research and the creativity and the productivity. And we're doing all that work anyway.
Right.
And now we're just getting paid for it.
Getting your benefit for it, right?
Exactly.
So you've put in 3 applications. As far as I know, you haven't been audited.
We have not been audited, that's correct.
So that's been a great success for you. You just worked with Bond and you got your refunds.
Exactly. I feel that there has been a lot of attention to detail in the submission of our claims, in terms of the preparation of our claims before submission, great communication between Bond and our accountants. The only interactions I've really had to do are very simple meetings via Zoom or telephone to clarify the status of our research projects, maybe via email elaborating on what has changed, what are some new updates or clarification regarding content and future directions. And so that's all things that you would have to do as a researcher anyway.
Right.
So really the level at which I'm engaging with Bond is on the same level as I would collaborate with any collaborator. It's just this group, Bond specifically, is collaborating with us on getting compensated for the work that we're doing.
And then you get a refund from the government afterwards.
Exactly.
And you worked with Gannon. Do you know Gannon is a full medical doctor as well?
I heard that. He told me that. Yeah.
So that makes it easy for you to collaborate with him. He's on board with everything.
And he understands the language. He understands the nomenclature. He understands how to, process and synthesize what it is that we're discussing. So it's been very, very seamless.
So what advice would you give to any other doctor that maybe is on the fence? They're incorporated, they maybe haven't heard about SR&ED, or maybe they got some bad advice. What would you tell them?
I would say that you really have nothing to lose, because at least from our interactions with Bond, I feel like all of the risk really falls with Bond in the sense that you guys are the ones putting in all the work writing up this documentation, making sure it's thorough and properly vetted and assessed before submitting it. If the claim doesn't come back, we've already paid the taxes. We're not going to pay more tax. We just don't get the claim. And as a bonus, if the claim goes through and we're able to have it filed appropriately, you get some reimbursement from the government for work that you're doing and that you deserve to be reimbursed for. So if you're doing all the hard work, if you're doing all of the creativity and driving the academic process here in Canada, you may as well be compensated for it.
Yeah, definitely take advantage of the SR&ED program. Well, I wanted to thank you for taking the time out of your very busy and very valuable schedule to talk to us today about the SR&ED program. Very happy to have you as a client with Bond Consulting Group, and I hope that we'll work together for many, many more years to come.
Thanks, me too.
Thank you very much.